Hello, I am Dr. Erica Onigbola. Thank you for joining me once again. I am coming to you today on this live video chat to talk about omega-3 fish oils and also other important omega oils that are derived from flax plant seeds and also fish. In particular, that's the mackerel, the sardine, the herring, and last but not least, I have it here, the anchovy. Okay, so with that being said, I'm gonna get started on today's topic. I have fish oil right here. I can show it to you. That is fish oil. It comes in 1200 milligram, and the directions are to take with the meal up to 3 times daily. Okay, and it is odorless because the fish oil is a natural source from fish. There might be a fish aftertaste after consuming this product. So just to reiterate, this is fish oil and it contains two very important ingredients, and those are EPA and DHA. Okay, EPA is also very important because it helps to protect the heart. It's an oil, a natural oil that helps protect the heart against cardiovascular disease, coronary artery disease as well. It helps to protect the heart from those events, not to treat, but to protect in the event of. And so I did study these two ingredients before, and I wanted to give some updated information about these two ingredients. Okay, they come in soft gels, they have low odor, and of course, they are natural. They come from natural fish sources. They were tested before, specifically the DHA, the docosahexaenoic acid, was tested in a placebo controlled trial in Alzheimer's disease patients, which proved eventually that there is no primary outcome for the benefit of DHA in Alzheimer's patients. So DHA is not currently used for Alzheimer's disease patients, but it is still used for heart protection, specifically coronary artery disease. Now, the fish oil product is 1200 milligram, and the content is totaling 720 milligrams of the EPHA. EPHA is stands for eicosapentaenoic acid. Eicosapentaenoic acid. And then DHA is known for docosahexaenoic acid. And these are very important omega-3 oils that are found in this product, in the fish oil product. Okay, and there are other fatty acids that are also contained in this product, but those are the very two most important fish oils available. It does contain gelatin, and it does contain other ingredients at a lower percent. And I also wanted to make mention that this product does contain saturated fats. It contains 1 gram per serving per 2 soft gels, excuse me. And besides that, it does contain some cholesterol as well. And the directions are to take 2 of the soft gels, 1 to 2 times per day. Okay. This particular bottle contains 85 coated soft gels. The odor is it is odorless because you don't smell the odor like you do with some dietary supplements or some herbal supplements, I should say. But by being a natural fish source, like I mentioned previously, there may be some aftertaste after consuming this product. So before you do start this product, especially if you're pregnant or if you're elderly, or if you have an allergic reaction to fish sources, please consult your prescriber before your healthcare provider before consuming any product of such. And it also says it's purified to eliminate mercury as well. So that's a smart fact in this product. There's no GMOs, no gluten, no wheat, no milk, no lactose, no artificial colors or flavors, no artificial sweeteners, no sugar, no yeast, no shellfish as well, and no starch. So, and this is a product from Sundown Naturals fish oil, omega-3, and it is a product that is over the counter. No prescription is required. I don't rarely see prescriptions coming into the pharmacy for fish oil. It's available at different quantities of soft gels and different discount prices as well. So if you're looking for an extra boost, if you're just a little more cautious about your heart health, or have previously had a heart event, a coronary artery event, cardiovascular event, a stroke, or anything like that, then I would suggest being on board with the fish oil. But first, consult your prescriber before doing so. Okay, and the next product that I had that contains omega-3 oils. It also contains omega-6 oil and omega-9 oil. Okay, and they're not derived from fish, but they are derived from the flax plant. That's flax plant seeds, which gives off an oil that is highly concentrated in omega-3. And that omega-3 is not DHA, it's not EPA, it is alpha-linoleic acid. Alpha-linoleic acid is also an omega-3 oil. The only difference is that it's derived from another source. Okay, and this product is called flaxseed oil, and it's 1,200 milligram, and it's cold compressed, and it is contained in a soft gel that protects it from a manufactured soft gel that is that protects the ingredient from light. So the light repellent of the soft gel helps to give the flaxseed oil longevity, and so gives it a longer freshness. And it's a dietary supplement. It supports heart and cardiovascular health. And it comes in 125 soft gel container. And it has a low odor as well. And has an edible oil. And it does contain gelatin. And I'm going to show you this particular brand. And the odor is very less, but by it having an oil content, you might want to separate both the fish oil, omega-3 fish oil that I just mentioned, and the flaxseed oil from your other vitamins and supplements and minerals, particularly your fat-based vitamins, A, D, E, and K. A, D, E, and K are fat soluble vitamins, and I recommend that you keep your vitamins in general away from the oil-based vitamins. Okay, and this one is called the flax seed oil, 1,200 milligram, and it particularly protects against cardiovascular health. That includes artery clogging, heart attack, stroke, any type of event, ischemic heart event, heart attack that the heart could experience. These items do protect, are known to protect against. Okay, and this one has not been tested in Alzheimer's disease patients, but it is available over the counter, and it is available without need for prescription. So you don't have to receive a prescription from your healthcare provider, but it is important to consult them ahead of time before purchasing at a discount price, just because there are some populations, such as pregnant patients, elderly patients, that need to be evaluated before taking over-the-counter dietary supplements. Okay, so omega-3 acid, alpha-linoleic acid, omega-6 is linoleic acid, and then the oleic acid is omega-9. So this particular flaxseed oil has three omega oils, that are plant derived. Okay, that's the difference between the flaxseed oil and the fish oil. You're going to see them come from different sources. The fish oil only contains omega-3 and other fatty oils, but it's derived from sardines, herrings, mackerels, fish, and you might experience, like I mentioned before, a fish aftertaste with those particular ones. Okay, and they are heart protective, and I do recommend, if you're eligible, to have those on board. If you had a previous event, or are recovering from an event, omega-3 and other omega oils should be on board. And mostly, it is a part of the guidelines to receive omega oils after a cardiovascular event, such as a heart attack or clogged artery. So the doctors on staff will go ahead and have those put on board after events, which I do agree with. So that's what I wanted to talk with you on this video about, and I hope that you do more consideration for your own health. Even if you've never had a cardiovascular event occur in your medical history, it may be good to put an omega-3 oil on board, especially if you're diabetic, or if you have high cholesterol, if you, like I mentioned previously, have had a cardiovascular event such as a heart attack or a stroke or ischemic event, then yes, I would definitely recommend that omega oil be put on board on your medication regimen. But first, consult your healthcare provider before doing so, because we want to make sure that we're doing the correct thing per individual. And the fish oil, I learned, the fish oil that's derived from these particular fish, these fish have natural oily skin and content. So it's easier to extract these oils from these fish, and to have them for our dietary supplement. It's gluten-free, no GMO, no artificial flavors, no lactose or dairy, and it eliminates mercury, purified to eliminate mercury, which is found in fish naturally, could be found in fish naturally. Okay. right? That's the fish oil from Sundown Naturals. And this is the Nature's Bounty flaxseed oil from the flax plant seeds. A different omega-3, which is the alpha-linoleic acid omega-3, omega-6, and omega-9. Okay, so it's interesting to learn about those and to review the subject matters. I, like I mentioned before, was happy to do a presentation at the collegiate level on omega-3 content and its benefits. So I am happy to review and share this information with you. Okay, I'm glad you joined me on today's topic. If you have any questions or comments, please let me know. Any topics that you'd be interested in hearing in the near future, please let me know. You can send that information over to me. I'll be happy to go over it with you. And feel free to keep in contact with your healthcare provider. And like I mentioned, if you're a diabetic patient, a patient who has high cholesterol, a patient who has had a previous cardiovascular event, I would definitely suggest flaxseed oil and or the omega fish oil. Okay. All righty. Thank you for joining me on this video. I hope to see you on the next video chat, and thank you for joining me. Bye-bye.